Hello everyone, I hope you all are doing good. Let's know the answers and explanation of the recent image-based questions I have uploaded for you guys to revise. So the first image is of a child with prominent ribs. You can see here the prominent ribs, and many students are getting confused with the options given. Guys, you can see very sharp beading-like pattern. So beading-like pattern at the costochondral joint, what does it suggest? It shows that the child has scurvy with deficiency of vitamin C. So this is not rickety rosary. This is actually scorbutic rosary. When we talk about trichotic rosary, it has less prominent bumps and it is less angular than the scorbutic one. Now, the second image we have here is a skin condition. And no, it's not seborrheic dermatitis. Seborrheic dermatitis presents with flaky, scaly, and greasy. So you can see crust on the lesion given. Here you can see yellow crust. The lesion is inflammatory, round in shape, and boggy with pus filling inside. It suggests diagnosis of Kirion. Kirion, as we all know, is a fungal infection. The fungus responsible for causing this infection is Tinea capitis. Now we'll focus on the third image we have is a barium swallow radiological image of GIT, which is showing abnormal shape of the esophagus. And this appearance is also known as a corkscrew appearance. It is seen because of the spasm going on in the esophagus in the condition called as diffuse esophageal spasm. Now we'll focus on the fourth image, which is the MRI of vertebral column, which shows the destruction of vertebrae, and because of the destruction of vertebrae there is compression of spinal cord, which is also very clear in this image. And this is a classical finding of Pott's spine. Where do we find this? So we find this in TB spine. Now we'll talk about the fourth image we have, and it is a classical bird beak sign. You can see here it appears like a bird beak here and visible on barium swallow to examine the esophagus, and it is seen in achalasia cardia. Okay, now this question is multiple time repeated PYQs. You have to very carefully read and understand this topic, guys. Let's talk about the last and sixth image, which is again a skin condition, and it is showing pink lesions with dimples. You can see the lesions are pink. So it is a condition called as molluscum contagiosum. This condition is also known as water warts. It disappears without leaving any kind of scar on the skin. It is a viral infection, and the virus is also like the name of the disease, which is molluscum contagiosum virus. So that was it for the video, guys. I hope you liked it. If you find it helpful, do share it with your friends and don't forget to subscribe. See you in the next one.